with Dr. Yolanda Marx. She's going to be sharing with us some of her daily duties and sort of regular duties that she does as a doctor and a practitioner, and also some of the things that we don't normally think of as part of our duties. This YouTube or Zoom is brought to you by the Regina District Education Council and Prairie South Schools, and we are excited to have Dr. Marx with us. There will be a short period of question and answer at the end. So if you have any questions along the way, just jot them down or put them in the chat and we'll make sure we get to them. With that, I will turn it over to Dr. Marx.
Well, hi there, everybody, and thanks, Mr. West, to having me chat about what it means to be a physician. I'll just tell you a little bit about myself. Yolanda Marx is my name. I studied and trained in South Africa. I worked a little bit in South Africa, but have mostly worked in Canada. I moved here in 2004, worked in a small community of Central Butte, 500 people. So I was a very full service physician there. And then in 2007, we moved to Moose Jaw, and I had a private practice as a solo physician. And then I started expanding a little bit. Now we're 3 physicians. Yeah, so that's basically, in a nutshell, what I'm doing right now. Then I just want to talk about a little bit about the studying to become a physician. Of course, this is different in every country, but in South Africa specifically, it takes you 8 years to become a family physician. It's a little different in Canada. Maybe it could be a little longer even, since in Canada, you usually have to do a degree first, and that's usually 3 to 4 years. And then medicine itself is 4 years of studying and clinical care. And then after that, it would be 2 years of residency. But on average, it's about 8 to 9 years in Canada to become a family doctor. And to be a specialist, it takes about 10 years altogether, but that's also dependent on the specialty. Some specialties takes a little longer. So 10 years would be the kind of the minimum for a specialist. An average probably would be 11 to 12 years. So I'll talk a little bit about the subjects you take at university. It's very diverse and everybody kind of takes everything at first. Anatomy, of course, is the training on what the human body looks like. It will be all your muscles, joints, nerves, brain, you know, everything that you can see and not see on the inside is what anatomy is all about. Physiology is how things work. Pathology is all the things that go wrong. So that will be on a molecular level, things that go wrong, but on a big scale level of everything that goes wrong and what it looks like. And this will be what it looks like grossly and what it looks like under the microscope. Pharmacology would be all the study of all the medications that we learn. We're basically full-fledged pharmacologists as well. Lots of countries, physicians, when they practice in a rural community, do a full pharmacy, run a full pharmacy as well. We also learn about how pharmacology and how medications change when you're actually ill. Forensic medicine would be anything that goes wrong with people in a traumatic way or an overdose way, car accidents. Every forensic medicine was very interesting, contained a lot of autopsies or, you know, seeing how they cut up a body after it was in an accident and what it looks like. Internal medicine is the study of all the organs. Mostly you focus on the heart, the lungs, the liver, but we do get a really good overview of all the organs in internal medicine. Orthopedics would be study of bones, joints, and muscles and the disorders of that. Pediatrics is study of children, and that would be considered up to the age of 18. I did put internal medicine twice, maybe because it's such a big subject. Anyway, surgery, that is everything that needs to be cut open or cut out or cut into. Lots of bowel trouble in there that we learn about. Psychiatry is mental health, illness, and we learn a little bit of counseling, but we're not counselors. We're mostly doing prescriptions for these things, but we're not like counselors, if you do need to see a psychologist, that's a different field. And then obstetrics and gynecology would be the study of all pregnancy and female health. So basically, in my typical day, we start a bit before most people. A day would start 7:30. My day usually starts with reviewing paperwork. And that is quite a big deal. We get on average about 80 documents into our office every day that has to be reviewed. These can come from a pharmacy, they can come from a specialist, they can be even a note from a concerned family member, a note from a nurse, notes from nursing homes. So we have to review all those documents and then decide who of those people need to be either phoned today, called today, prescribed today, and then we kind of triage and see how we deal with that. I try to do this, of course, before my day starts, but it also depends on when your staff starts, because sometimes they only start at 7:30, same time as you, and they haven't loaded all the faxes for you yet. You could just kind of finish yesterday's work. Usually my patients start at 8 a.m., but again, I'm probably a little earlier than most. Some doctors only start at 9:30. Before that, some doctors go and do a ward round. I didn't put that in there since right at the moment during COVID, we're not doing much for ward rounds since the hospitals have hired hospitalists just to stay in hospital and stay there and just do the inpatient care. So the doctors from our offices, we don't have to go in and out and carry more risk into the hospital. But you would do a ward round either before you start your day, in the middle of your day, or at the end of the day. It's a doctor's choice. I take a lunch, and I usually use my lunch to do a bit of exercise. I don't get it done before or after work. And then for 4:30 is cut off. It's usually in my day. After you see your patients at 4:30, then again, there's paperwork that's loaded up for you. Mostly for me, that would be referrals to specialists, a few other prescriptions, and maybe an odd phone call to a patient. And then see patients in hospital. That's what I put there, that, like I talked about that in between, you can do that. Or for me, sometimes after work, I have a shift in the emergency room from 5 to 9, where I'm like the extra doctor on. What is interesting is that we could get interrupted all day long though as well. If a nurse phones you back from long-term care because one of your long-term care patients deteriorated, you'd be interrupted during day. So you'd have to just excuse yourself, or maybe just finish the patient you're seeing right at the moment and then go and take the phone call, deal with the issue, and then come back to the patients. So my day can be anywhere from 18 to 14-hour days. There's some extras in a day that we, some doctors do and some doctors don't. I like little procedures, so I like removing skin lesions by excision. This will be like a local anesthetic. I don't do any general anesthetic in the office, but inject some local anesthetic and remove a mole or remove a lesion. I do pregnancy and baby care. I don't do deliveries of babies, but some doctors, of course, will do that as well. So they get called out to go get a baby delivered and then come back to the office. Flushing out ears is very common, but not all doctors choose to do that. It just looks like a big syringe. We flush out the wax. Home visits would be actually going into somebody's home, especially those aged people, some people with mobility issues, or sometimes even people are just very ill. And we can go into their homes. And then long-term care visits. Long-term care visits, we each have a few patients usually in long-term care. And those patients have to be visited, depending on how ill they are or how advanced their dementia is. We might have to go once a week or once a month. I also do some training of students and residents. Students come for blocks of periods of time. So they come for 2 weeks to up to 6 weeks at a time. And they're with you full time for those weeks. Residents are doctors that now have finished their studying, but they're still training under a physician to do their last 2 years of clinical. They are called doctor at that point, but they still have to have some supervision. Residents are not with you full time. They come in and out. They usually do some hospital care in the mornings, and then they come back in the afternoons to your clinics and see patients with you, or even independently, just under supervision. End of life care is also not something everybody does. End of life care would be involved just into some medications here in the end of life where people struggle with pain or shortness of breath and things like that. Not everybody is comfortable prescribing these medications. End of life care can be done in a home or in the hospital. And so that involves some counseling with family members as well. And then sign some death certificates. Now, it's funny, my kids didn't know that I signed death certificates, but it's actually very important. Those statistics go up to the government, and it's important for people to get some life insurance that's paid out. So it's a very important part of our work, actually. So we are business owners for the most part. That's there on the next slide. We do have to rent space or buy space. We have to furnish our offices. We have to employ and train and pay our staff. We have to enroll our staff into workers' comp, enroll our staff into EI. We have to order all our medical supplies. We have to have office supplies that we have to keep track of. We have to do our bookkeeping or hire a bookkeeper. Our billings that we do, we send it up to the government. And so if things aren't paid, we have to follow up on those bills and claims and phone patients back and see, why they didn't have maybe their health insurance coverage at that point. We have to make sure that the offices are cleaned well and properly with COVID standards, of course, at the moment. And then we are not actually employees and contracted by the health regions for salaries. So that means that we're independent contractors, even though we are licensed by the health regions. That would mean that we don't get things like pensions and maternity leaves. We don't actually get paid leave. So you have to save for your own future retirement and for your own holidays and time off being away from work. I would say that the benefits of being a doctor, and this is something that I looked into before I studied medicine, would be the flexibility in hours. It sounds like we have long days, but we can choose to have long days or not. You could choose to work in the emergency room or not. For instance, I decided to take Friday afternoons off, and I only work Wednesdays till about 3. And that's your own prerogative. Nobody's going to tell you how and when to work. So I love that. If I really feel like I wanted to be with my children for an afternoon, I can surely do that. A really nice thing for me specifically is the long-lasting and caring relationships that you do make with your patients. It's a really great trusting relationship. People really open up to you. They tell you things that nobody else tells you. And it is just a wonderful thing for me to have these relationships with people. Sometimes you see somebody more than you would your own family members. Another thing that you can do is focus your practice. So if you don't want to be as general as a family physician, you can focus your practice into doing certain things only. I know a few of my colleagues that decided only to do women and children care. I know a few of my colleagues that love sports medicine. They would be at every hockey game. They would be at all the riders' games. They might be actually, part of their riders' physician group that they go and attend. So if you don't like obstetrics and gynecology, you can totally cut that out of your practice. You can focus on men's health, things like that. Of course, everybody knows that physicians are a bit higher income than the average population. And that's of course very nice. You can do a little bit more with your holidays, and that's sometimes some other people can do. I find it great job satisfaction, and that goes with not being bored. I was a kid at school that really needed to be stimulated. I hated being bored. I hated doing the same thing over and over. And so this is the same something in medicine that you'll never get. There's not a day that goes by that's the same as the next. And medicine is always changing. Like right now, we're really looking at these vaccines that's coming. So it's just never dull. I would say some of the disadvantages of being a physician is the long hours. Burnout is common with physicians. And burnout just means that even after you've taken a holiday, you don't feel refreshed. You get a bit on the downside, a bit depressed if you're not taking care of yourself. Of course, you have some good ways of dealing with those things. You could choose to have shorter hours, and you can make sure you exercise, eat well, get with your good friends and things like that to build up some resilience to not get burnt out. Another part that is that's hard is the incredible responsibility that comes with being a physician. You carry a big load of responsibility with these people, and really you're not allowed to make mistakes. If there's some small things that happen, we're pretty hard on ourselves. If we miss a result, we feel awful about it. So that's hard in medicine. Nowadays, there's the risk of infection with COVID, but of course, there's always the normal risk that we carry for needle stick injuries, infections. We're also quite at high risk for developing some resistant bugs that hang around the hospital, which we're in around. If you don't wear enough of your gloves, don't clean your hands, you can get lots of diarrhea and things like that. And I don't know if this is a disadvantage. For me, it's an advantage, but always have to keep learning. Like I said, medicine changes so much. There's always new things on the horizon. There's always going to be things that you don't know that you have to keep learning about. So I take questions because I didn't put a whole lot of exactly what I do in a day. And if there's any more questions about that, I'd love to take some.
Hi, I have a question for you.
Hi there.
What did you find the hardest with the application process to get into med school?
I think just having an incredibly high mark for us, and our medical school was very competitive. So my medical school was 200 kids, and there was 2,000 kids apply to medicine. So I think that was the hardest part of it. I didn't initially actually get into medical school. I was put on a wait list. My marks were good, but there was just literally too many people ahead of me that had the same marks. It didn't take me too long to get in, but we were lucky in South Africa that we could attend medical school right off the bat. So right from grade 12, you applied to medical school. You didn't have to do a full degree, but some of my friends had to do that. I would say also the other part about the studying about medicine is interesting. Something that nobody's ever shared with me as a student, but just touching people in general was hard for me. We are very respectful for people's boundaries in general in Western medicine and Western world. We don't just touch people, especially in general areas, or, you know, we don't touch the opposite sex unless it is something that is, you know, you got a relationship with somebody. So I found that very hard. I was raised pretty conservatively. So just knowing that I had to put my hands on another person, it was quite a learning experience for me.
Thank you. Did anyone else have questions, or can I ask my other questions? I have a few.
Keep going.
Okay. What does the process of starting your own clinic look like?
Yes, if you start from scratch, you are literally looking for a space. You could go to a realtor and say, you know, you're looking for a space that would accommodate an exam room, an office, a front staff area. You rent the space. You make sure that you're licensed with your licensing body. So for us in where I'm working, I had to apply to have privileges in my area. So that would be the licensing or the your health region. you would go and apply to the health region. You would tell them what experience you have. Then you get your privileges given to you. As soon as you have your privileges, you can practice in that area. Then you have to, or get a good staff member. You probably want to find somebody that has worked in a doctor's office before, because they have to know the electronic health record. They probably want to know a little bit about billing, and unless you've been trained how to do the billing yourself. You make sure you have a working fax machine, make sure your computers are up to date, make sure you have your insurance is paid for, make sure you have somebody maintaining your computers and things like that. And then of course it takes quite a few things in an office to work. You need exam beds, you need to have a front office with chairs, you need a few tools, not a lot of tools. We don't use a lot of tools, but you have to have a working stethoscope. If you're listening to baby's heartbeat, you need a fetal Doppler. You're going to need reflex hammers. And then your medical supplies, of course, you need some injectable things. You need cortisone things, you need freezing, you need your needles and syringes. For women's care, you need a few equipment for that. Does that answer your question?
Yes, thank you. And I have one last one. So I read that a problem doctors can face is like lawsuits. Is that true? And what does that look like? And what situation would that happen in?
Yeah, they say on average a physician, and a general physician, that will be a family physician like myself, will be sued in a lawsuit about once in your lifetime. In Canada, we're pretty good for that, so about once. Usually it would happen if somebody feels like something went wrong. Now, give you some example, maybe of something I know of. For instance, a baby gets born. There was a bit of delay of having the baby deliver. The baby had a bit of trouble getting air, and maybe that child goes on and develops some complication from that. So maybe a learning disability. That parent may feel that delivery didn't go well, that maybe that doctor didn't act fast enough, and puts in a lawsuit that say, if it wasn't for a neglectful thing here or there, this child of mine might be better off. All physicians pay into a protection plan. It's a mandatory. We don't have a choice. You have to pay into the Canadian Medical Protection Association. And it's actually quite a fee. It's about $460 a month. But that also gives you free legal advice, free legal representation if you do end up in a lawsuit. And they have a panel of lawyers standing by to help you figure out what happens. A lot of the lawsuits, it actually ends up with a physician not at fault, and it's just because that people do have to understand that they do have some risk. For instance, if something goes wrong in a surgery, we counsel those patients that some of these things may happen, even despite the patient and the physician's best intentions and the physician's best surgical skills. Something can split open after. It's just one of those things that can happen. And lots of the lawsuits actually ends up being with the physician not at fault. However, if the physician is found at fault, you may face a fee. You may face suspension if it was a terribly neglectful thing you did, or a gross mistake, especially if there was something like sexual assault involved. That doctor will probably then lose. He'll face a fee, and then he will face some reprimand from the College of Physicians and Surgeons, and then he or she may lose their license altogether.
There's a question here on the chat from Taryn. How would you describe the schoolwork and workload at med school?
Intense, I suppose, would be a good answer. Medicine is definitely a big load. Lots of medical students are not the type of students that would have lots of time to work outside of university and get a lot of time to hang out with friends, your workload is definitely high. And especially if I mean, this is just not a job that you can not know what you should be knowing. So there's a lot of studying involved. I would say that it was pretty intense. There's a lot of times that I wish that I could just go out with my friends and just be a bit more social, that I chose not to. And eventually I'm happy about it. Now in my life, there's a lot of time after you've already become a physician that you have some things and you have the ability then to travel and do things that you may have been missed out on when you were studying. I think it's worth it, but yes, it's a high, heavy load.
Are there any other questions out there?
Well, you're welcome, Karen.
So the question back here is there a big demand for physicians right now? I know we talk about shortages in healthcare in different capacities, but specifically with the medical doctor. I know the University of Saskatchewan only literally puts out so many graduates, but what are you seeing being in the field right now as a medical doctor?
It's a little bit dependent on where you are. I mean, I don't think that's Saskatoon, for instance, are lacking any physicians. They have every specialist you can think of, but in the rural parts of Saskatchewan, there's always a deficit. That's what I was recruited to, of course, initially when I moved away from my home country. But even in a place like Moose Jaw, we usually can have another 1 or 2 physicians at any point. We're not doing too badly at the moment in Moose Jaw itself, but for a family physician, there's always demand.
Your presentation was awesome, Dr. Marx. It obviously shows that there's not a whole lot of questions happening, because I think you've probably done a very good job answering everything that needs to be told right now. So that's awesome. Thank you.
Well, thank you very much for having me. It was a pleasure.
So thank you to all the students who showed up. There are a few that arrived late. This has been recorded for YouTube, and the links will be posted on the 2 websites. So if you're interested in catching up on what you missed, you can definitely do that. There's also a survey on the RDIEC site that will help us with funding and get some feedback for how we can do this better. So if you would do that, that would be wonderful. So thanks again, Dr. Marx.
You're welcome.
Taking time out of your busy, crazy schedule of little COVID. It's very helpful for the students, I'm sure.
Good.
Thank you.
Have a good day.
Bye.